Now, one may ask, why choose 308 nanometer laser? Why not another wavelength? And in making this choice, one must consider laser physics. We must consider absorption depth, absorption mechanism, and absorptive losses. The different laser wavelengths absorb very differently into tissues. When a surgeon uses a CO2 laser, he is hoping to coagulate tissues below where he's actually cutting so that there's no bleeding. But when we're using a laser from an intravascular application, we want to be able to carefully sculpt away only those things that we touch. We don't want the laser to burn through and through a blood vessel. Now, when thinking about laser, we have to think, how does light work? How does this light affect anything? And so first I ask you to think back just to elementary school physics and remember the basic little experiments we did with light. We know that light energy is either absorbed. A good example of that would be putting a piece of black construction paper up, and it absorbs much of that energy. It gets hot very quickly. It can be transmitted, such as a window. It can be refracted, like a prism bending a light. It can be dispersed, as a diamond takes light and throws it out in all directions. Or it can be reflected, and that's what a mirror does. One or all of these phenomena may occur whenever light interacts with matter. That's just simply what light does. Now, arterial plaque selectively absorbs 308 nanometer light, and arterial plaque is made up of many different things. It's made up of smooth muscle cells, it's made up of calcium, it's made up of clot, and clot absorbs 308 nanometer light very effectively. So does arterial plaque and smooth muscle tissues. The most resistant of the parts of plaque happen to be those calcific parts. However, laser is effective in calcium resorption as well.